Welcome to NCPDP, Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators, discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
Well, Tanvi, welcome to our new podcast, NCPDP Unscripted. Excited to have you on.
Thanks for having me.
Yeah, I think we met just a couple months ago at HIMSS. I remember seeing you on a panel, so excited you were able to join us here.
Yeah,
so
it's always great to be here.
Yeah, great. So I'm sure some of our members know who you are, but I don't think all our listeners do. So you want to just introduce yourself and what you do?
Yeah, absolutely. Thank you so much for having me, Pooja. Tanvi Patel, Vice President and General Manager of Amazon Pharmacy. So for those who may not be familiar, Amazon Pharmacy, full service digital pharmacy, home delivery to all 50 states, and we'll get into some of the areas that we're focusing into, but really excited to see what customers are saying about the service and how we're helping to deliver on some of the gaps in the space.
Fantastic. Excellent. Well, let's dive in. We've been seeing a lot of traditional retail stores closing. And, I think just yesterday or the day before, we saw that Rite Aid is going back into bankruptcy and closing more stores. So would love for you to just kind of start from your perspective, how's this reshaping patient access to medications?
Yeah, so, Pooja, when pharmacies close, it leaves a gap in patient care. And when we see more and more of that, more and more patients are not taking their medications, it leads to inadherence of medication, leads to worse health outcomes, and just more burden on the industry. I mean, this is just the normal course of action. And so this is where a lot of digital pharmacies are coming into play to help deliver on those gaps. We have designed our pharmacy around 4 C's, with being customer choice, convenience, clarity of cost, and the continuity of care. This is where our convenience aspect really comes in. When patients have convenient access to getting their medications, they're more likely to take them, more likely to remain adherent on them, and more likely to remain healthy.
Yeah, we just had Scott Biggs from IQVIA doing the report this morning. It was amazing to see just the drop off of adherence. So I could see how that could help a lot. So that's great. Amazon Pharmacy, is really kind of seen as a disruptor. And I would love to kind of better understand just kind of some of the solutions that you guys are building, really in a way that addresses both consumer needs and healthcare system efficiencies.
Absolutely. So, you can disrupt an industry or you can impact it. Like to think more of it in terms of impacting an industry, inspiring others to follow leads. It's really been in Amazon's playbook to think about it that way, like thinking about the customer experience, what's lacking today, do we have the core competencies to help address some of those? So if we think about 2 areas in which maybe the healthcare industry, the experience today could be improved. It's the customer experience, the transparency of the actual experience, and then it's the convenience aspect and the logistics. So we're addressing this in 2 different ways for patients and, to your point, the providers or the health systems, the actual burden on the system. And these are related, right? Because when patient care is interrupted, it puts a strain on the actual system. And so we need to solve the root cause of this. And so we're thinking about it in a couple ways. We have some integrations that we're building. We've already done this with some like Photon, One Medical, and several others where you see transparency. You can see patients and providers can see how much will the medication cost. Is it available in stock? Inventory is something that for some reason is not as transparent as it should be in an industry that is, for all intents and purposes, a retail transaction. Right. And then also the convenience in terms of when is it going to be delivered? What is the promised date? And does that work for the health that you need? Do you need it today? Do you need it tomorrow? Does this work for you? And so if that is transparent, that's the patient experience. But translate that to the provider side as well. Now at that point of care, patients and providers can have the conversations that are very informed and make decisions that are the best for them in that way.
Yeah, and we're excited to have you guys as part of our pilot program that we're doing for the inventory.
Yes.
It's interesting. We also had, I think, one of your prior colleagues, Vin Gupta, as one of our keynotes, and he had talked about some of the pilots, right, that you guys were doing with Amazon Clinic.
That's right.
Would love to just, kind of your commentary on that as well.
Yeah. So 2 things come to mind there. One, yes, on the Amazon One Medical pay-per-visit, as now it's called, is a telemedicine, telehealth marketplace. So you think about episodic conditions, hair loss, eyelash growth, acne, conditions where often they're not covered by insurance. They're coming in, they're finding the right provider for that care. If you start that care digitally, you're more than likely to complete that care. That's where the C of the continuity of care comes into play. If that medication is going to be delivered to your doorstep too. If after you've had a digital visit, you're asked to go get in your car and go get it, you're less likely to get it, and then your care is disrupted. So that's where it's working so well, because we were seamless integration. After you see that telehealth provider for the condition, your medication is sent to Amazon Pharmacy, it's delivered to your doorstep either within hours or within a day, and that really helps for that course of care to continue. The other integration is with One Medical. And so when you think about One Medical, member-based primary care, if someone goes into One Medical and they're having that informed conversation with their provider and they send it to Amazon Pharmacy, again, it's just that continuity of care.
Yeah, it just makes it easier for the patient,
Correct.
which is so important. That's
Right.
fantastic. So I also love the transparency aspect, and I've been a big proponent for kind of real-time benefit check. On your phone, you should be able to know how much a prescription costs. I think you guys are doing some work in that area
We
too,
are.
right?
Yes. So in this area, this is a really big goal for us. A lot of times folks ask about, what are you focused on if you could just choose one thing? And it's really about transparency. Transparency in every aspect, but really price, to your point. When you see an ad for a medication on TV and you want to say, is this right for me? You also want to know, how much is it going to cost me? And we would like for patients to be able to do their own research if they want to, and look on Amazon Pharmacy to say, how much would this cost me? As an authenticated user, you have my insurance information. How much is it going to cost me out of pocket? And then they can have that discussion with their provider. Is this medication right for me? Is this therapy right for me? And then can I afford it? And if I can't afford it, they can talk about therapeutic alternatives. That transparency is key to helping to reduce the administrative burden for everybody, and honestly, the strain, the stress that is caused often by is it a third of patients in this country can't afford their medications, but many of them don't know if they can afford their medications, and so they're rationing them or they're not taking them. And this helps address that problem.
Yeah, no, that's fantastic. And I think the worst thing is, I think we've all been there, right? When someone in front of you is at the counter and they walk away because they don't find out until they get to the counter how much it's going to cost. So having that so important. So of course, we're at NCPDP. One of our big themes and things that we're starting to focus on is interoperability, and having the pharmacy. So we're starting to see this expanding role of the pharmacist, right? Being able to do more clinical services. Are you guys doing anything in that area, or kind of how are you thinking about all that?
Yeah, our goal is to have our pharmacists just operate at the top of their license. That is the ultimate goal. It helps with pharmacist satisfaction, on their job satisfaction. It helps with their ability to serve our patients. And so there's a couple ways that we're going about this on that front, which is to help reduce the administrative burden, and we're implementing a lot of tech, which is an area of expertise for us. So it helps us to think about, how can AI help automate functions that a pharmacist is doing today, so they can free up their time to do what they can do at the clinical top of license. Also, our pharmacists are available 24/7, so we have patients calling in the middle of the night. We want to make sure that they have the information available to them to take care of a patient that may call at 3 a.m. So all of this really helps. The other piece on interoperability, though, it doesn't work if we're not interoperable, right? So the other C of our 4 C's is choice. Patients should have choice in where they get their care, and it only happens if all of the systems are talking to one another in that way. And this is where, once again, working with NCPDP on pilots to interoperability are key.
Yeah, absolutely. And, the pilot program is something a little bit new for us, too. So it's exciting to get, folks that are thinking a little differently and innovatively as part of that. So as we look towards more kind of patient-centered healthcare experience, how important is it for patients? You already, kind of talked about choice, kind of that choice of where their prescriptions are being filled.
Exactly. And it is very important for patients to have agency in their healthcare. And agency comes along with information. So this is where if you provide patients with all the information they need to have that informed conversation, then they can choose where to get their medications, how to continue on their medications, where to get their care, and who they trust for that care. But if they decide that something is convenient for them and then another option is going to be convenient at a different stage of life,
Right.
we should make that simple. What is easy, it should be easy. It shouldn't feel like you're stuck.
Right.
It shouldn't feel like I've made this choice and now this is my choice until further notice. So that's where we're really big on making sure that all the systems are interoperable, they're speaking to one another, patients have agency to their own health information
Right.
and to where they get their health care.
Fantastic. So kind of looking ahead, what are some of the trends that you and innovations that you guys are thinking about and looking at? I mean, we touched a little bit on AI, there's digital therapeutics, things like that. Are you guys looking into any of that?
Yeah, I'd say all of the above in different levels of prioritization, right? So AI, absolutely. AI is going to be raising some of the standards in this industry at a faster pace than we've known in the last couple decades. And I think we're going to see some really great improvements in efficiency and access to healthcare in that way. All of the digital pharmacies that are coming up is also another one, just to see how much investment and the customer interest and the adoption. It's always hard to create a new habit.
Right.
And as long as we're serving those gaps, you're going to see more and more customers engage and adopt to help take care of themselves better, as long as we're continuing to innovate on their behalf. So listening to the customer and working backwards is always going to be really important in this space, and I see more and more innovations coming to that light.
Yeah.
And then you're going to see a lot more of providers and pharmacists operating at the top of their license, which, frankly, has kind of gone away in the last couple decades as the administrative burden has increased. So as we think about how prior auths are done and how we think about how scripts are transferred between pharmacies, how providers send them through as more and more, obviously eScript is becoming more and more prevalent in 35 states and then more. So these kinds of automations and these kind of what becomes a norm, the standards, it will help improve health outcomes, which is the goal.
Yeah, absolutely. Well, I know at NCPDP we have a lot of data and we're tracking, closures of pharmacies. So I think, having you guys in that position that you're in to be able to kind of fill those voids is so important. So it's great to kind of, have you guys in the mix and doing some of the innovative things that you're doing. So I know we're kind of down to our last minute. Anything else that you want to share with our listeners?
Well, thank you for having me. I think it's been an excellent opportunity to work with you guys. We're really, really committed to helping to improve the standards in the industry so that we can continue to help serve patients. And, it's really, again, about choice, continuity of care, convenience, and just clarity of all the information you need to take care of your patients.
I love those 4 C's.
Yeah.
I remember you talking about them before, so that's a great way to approach the market.
Absolutely.
So, Tanvi, it's been wonderful to
Thank
chat
you.
with you and really appreciate you joining me today.
Thanks so much. Thanks for having me, Pooja.
Yeah, absolutely.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.